The U.S. News & World Report recently rated the D Scott Hudgens Center for Skilled Nursing the best nursing home in the state of Georgia. They are the very first in the state to utilize the Quadriciser motorized therapy system for their patients. And this is what they had to say about the Quadriciser.
As administrator of the #1 nursing home in the whole state of Georgia, that's according to U.S. News & World Report, isn't it?
Yes, it is. We're very proud of it.
And tell me what you think about the Quadriciser.
I think on top of everything else we do, it's a fantastic addition. We've seen great results. My therapists love it, my nurses love it, and above all, as you can see, it's benefiting the patient in many ways. Yeah. Well, I've seen better range of motion. I've seen people that were contracted able to open those contractures. I've seen people walk down the hall straight and good posture that normally don't have good posture. The repetition is just phenomenal, and they look forward to getting on it. Residents come up and ask us if they can get on it today. Of course, everybody has a schedule, and it's based on what the therapists feel the greatest need for that particular person is.
Some residents who were contracted some and had very limited movement, had more increased movement on their hands. Just their spirits were uplifted. A resident who's usually more agitated and not always too happy just was a new person just coming off the machine, let alone what it did for him physically.
Mm-hmm. And it's awesome. Just it's amazing to see the cognitive improvement, the mobility improvement.
Now come walk to me. Come on. She's even walking more straight. She's
walking straight.
Go give Mama a hug. Go give Mama a hug.
Look how smooth her gait is.
Go give Mama a hug.
Her stride length was a lot more consistent, and the pace of her gait was a lot quicker pace. And normally she's really, just on her toes. She actually had a little bit more heel strike, a little bit more continuity and consistency with her walking.
Mm-hmm.
And she wasn't walking at all.
Legs going.
Amazing, absolutely amazing. They're
Sorry, we're clear way. Now she's
It's like a whole nother world, like she's waking up.
Say hi to your sister over there, Margot.
Yep, she's taking further steps herself. It's not us.
Right. Nice and strong.
Her feet are straightening out?
Yeah, her feet are straightening out.
Oh, the improvement has been miraculous. She got up and walked out of the Quadriciser about 12 or 15 steps, and she just seems way more alert, and that's the main thing, the alertness.
Diane, do you hear her?
Martha, can you smile?
She was
Look at her, she's clapping for herself.
It was amazing. She was more stimulated when she came off of the Quadriciser. Her feet were not red nor blue. They were perfectly as white, and the circulation was just like ours would be. So I am very happy.
And she used it only about?
She used it about 20 minutes.
20 minutes.
That was
made
it.
A difference, didn't it?
It sure made a difference.
Okay.
A lot of our folks here on campus are having improved self-esteem because of being able to have something that they're successful with. Because they struggle with a lot of things, and there are challenges with doing lots of different physical activities, but when they have one that pretty much does the work for them, but they feel the results from it and things, they feel successful. So their self-esteem and confidence is just skyrocketing.
Seen her before, Rachika? It was not
Do you want to feel
like
it
this
too?
at all.
Yes,
It's much looser.
yeah, stretch it out.
Good girl.
Good job. Can you stretch out that way?
Can she move it?
Good job. She's lifting it a lot higher.
Yeah.
It's like that, and them was stuck. Cool.
Do you like it?
Yeah, I like them more.
Uh-huh.
They're great. You like that?
Yeah. It's all stuck together for me.
Show me how it was before.
That's stuck like that before.
All jammed up like that?
And
now?
it's like that before.
And now what does it do?
That.
Wow.
It wiggles more.
Yeah.
I have never seen her walk.
Don't be running. The mom knows
Okay.
the best of how she did before.
The other guys would know a little bit more.
Smile. You're on candy camera.
Smile, you're on candy camera.
Yeah.
Her muscle tone was high, pretty high earlier. She had, and her fingers, they were it's stretchable, contracture, but now it's easier for me to straighten it out.
Yeah.
So the tone seems like it's reduced a little with that.
Uh-huh. And she
it's
used.
easier to range it.
Okay, so it's easier there.
Yeah.
And the shoulder and the elbow,
And
right?
shoulder, elbow, and hand. And I think even actively she's doing a little bit more.
Only
Less
15 minutes.
resistance.
That's with how much?
15 minutes.
It was more kind of fisted.
Yeah.
But it's not as fisted now. Can you move it up? Can you show me if you can raise it up? She's going up higher.
Look at that.
She's going
She's
up
still
higher
climbing.
on that.
She's still
Yeah.
climbing.
Bring it down. Do it again. Can you raise it up again?
Is that pretty high?
Yeah, she's taking it higher than what she could.
At least how many degrees?
I would say at least 10, 15 degrees more.
Wow, that is a lot in 15 minutes. You can imagine if it was.
And it seems like it's easier.
And we didn't keep adjusting her either.
Yeah.
You know, if we had kept going up maybe every 3 minutes, going up in range, probably
Yeah.
get more, but we just kept it as it was.
Can you bend your elbow? This
I
one.
like this one.
And there. And straight. Wow. Straight.
I know you want to do it if you're
Bend.
good. Strong, and we're doing it.
All right. Straighten it out. What do you think, Kathy? Is it easier for you to move it right now?
Now we're cooking. See how you walk.
Is that better?
It is better than right leg. Let's put out in front of you. Here we go.
Look all your foot is stupid.
What do you think? Is that better?
That's better.
It has helped with our range of motion. With restorative care, one of it is doing range of motion for either passive or active. And those that are able to do it on their own, we help them, we motivate them to do it. We've developed a schedule that is according to their likings, and we have them, and we make sure that they're staying as long that it'll benefit them. And also that it's at a setting that will give them a little bit of resistance, so they're actually benefiting from the exercise. And then for those that need the range of motion done, it helps, one, free up staff, because now the machine can help do some of that range of motion for them. And I think it's also just because it is more mechanical, I think it's also ensuring that the body mechanics are done correctly, that their posture is kind of kept a little better, because it is a mechanical device, and also doing it at a rate of giving them a little more strength and resistance that they would need, that they probably wouldn't always get with manually having it done.